I am Dr. Natalie Harmon. For over 2 decades, I have been working in the field of neurology, spending time every day with patients struggling with nerve pain, numbness, and burning sensations in their feet. And I can tell you this: the vast majority of patients who come to my clinic arrive with similar complaints. Doctor, I feel a burning sensation in my feet at night. It feels as though I am standing on flames. But when I touch them, they are cold. I am not doing anything, just sitting, but this burning sensation is driving me mad. Doctors have never been able to explain why. I hear this complaint so often that I can now say with certainty, burning feet does not appear randomly. There is a reason. And in most cases, that reason is treatable. Today I am going to tell you the real source of this burning, what is silently happening inside your body, and the steps you can take to stop it. Do not forget to watch until the end. Because the fourth reason is quite remarkable, and there is a very good chance you have never heard it before. First, let us understand, what is burning feet? Burning feet is evaluated in medicine as a symptom. Meaning it is not a disease on its own, it is a sign that something has gone wrong. This sensation is usually described as follows: burning, heat, tingling, or a pins and needles feeling in the soles of the feet or the toes. Most of the time this sensation intensifies at night. Sometimes it presents alongside numbness or weakness. And here is the critical point: this sensation is your brain's way of warning you. Your nerves are saying there is a problem, pay attention. So what is that problem? Reason 1: Peripheral neuropathy, the most common cause of nerve damage. Peripheral neuropathy is the condition where nerves outside the central nervous system become damaged. This is the most common cause of burning feet. Your body has billions of nerve fibers. Some of them extend from the brain down to the legs, feet, and fingertips. These nerves are responsible for transmitting signals such as pain, temperature, touch, and pressure to your brain. When these nerves are damaged, they begin sending incorrect signals. There is no actual burn, but the brain receives a burning message. There is no actual touch, but tingling is felt. Peripheral neuropathy has many causes. But the most common one is surprisingly the effect of blood sugar. Are you currently experiencing burning in your feet? Write Y1 in the comments. Reason 2: blood sugar toxicity, even if you don't have diabetes. This point is extremely critical and a reality most people are unaware of. You do not need to have diabetes for nerve damage to occur. Repeatedly rising blood sugar is sufficient on its own. Every time blood sugar rises, sugar molecules begin sticking to nerve fibers and the tiny capillary vessels that nourish them. This sticking causes inflammation, oxidative stress, and damage to the myelin sheath that protects the nerves. Over time, the nerves become unable to transmit signals correctly. And this damage first shows itself in the most distant areas, meaning the feet. A striking finding revealed by research: in individuals with prediabetes, meaning those whose blood sugar is elevated but not yet at the diabetes threshold, the frequency of peripheral neuropathy is nearly equivalent to that seen in full diabetics. In other words, saying my blood sugar is a little high but I don't have diabetes may not mean your nerves are safe. If your HbA1c value is between 5.7 and 6.4%, you have prediabetes. And even at this stage, your nerves may already have begun to sustain damage. When did you last have your blood sugar checked? Write K1 in the comments. Reason 3: vitamin B12 deficiency, the building block of the myelin sheath. The myelin sheath that protects the nerves functions like the insulation layer of an electrical cable. When this sheath is damaged, signal transmission is disrupted and symptoms such as burning and tingling appear. Vitamin B12 is absolutely essential for the construction and repair of this sheath. B12 deficiency is extremely common in individuals over 60. Why? First, stomach acid production decreases with age and B12 absorption becomes more difficult. Second, and more critically, certain medications significantly block B12 absorption. Stomach protectors, meaning proton pump inhibitors and metformin, are the most common drug-related causes of B12 deficiency. If you have been taking these medications for a long time, your B12 level may have dropped to dangerous levels without you being aware of it. And I want to emphasize this in particular: the symptoms of B12 deficiency develop slowly. They can go unnoticed for years. But during this time, nerve damage continues to accumulate silently. I strongly recommend that everyone who takes regular medication have their B12 level checked at least once a year. Have you ever had your B12 level checked? Write B1 in the comments. Reason 4: small fiber neuropathy, the diagnosis most doctors miss. And here is the fourth reason that will surprise you most. Why is this so critical? Because standard nerve conduction tests, meaning EMG, and nerve conduction studies measure large nerve fibers. Small fiber damage can come back normal on these tests. So patients go around for months, even years, with their complaints. Tests come back normal. They are told there is nothing wrong with your nerves. But the burning continues. These patients require a special skin biopsy test. This test measures the density of small nerve fibers and can definitively reveal small fiber neuropathy. Among the causes of small fiber neuropathy are diabetes and prediabetes, autoimmune diseases, B12 and vitamin D deficiency, certain medications and toxic substances, Sjogren's syndrome, and celiac disease. If your tests keep coming back normal but the burning continues, ask your doctor for a small fiber neuropathy evaluation. Reason 5: thyroid disease, a little known but important connection. Thyroid insufficiency, meaning hypothyroidism, affects the nervous system through multiple pathways. First, low thyroid hormones slow down nerve conduction. Second, hypothyroidism can cause fluid accumulation in the body, and this fluid buildup puts pressure on nerve channels. Third, thyroid hormones play a direct role in the protection and repair of peripheral nerves. This is why burning feet and numbness are extremely common in individuals with thyroid insufficiency. But here is the problem: this connection is most often never made. The patient is referred to neurology, nerve tests are done, sometimes they come back normal. But nobody thinks to check the thyroid. Thyroid insufficiency is extremely common in women over 60 in particular, and the vast majority are undiagnosed. If alongside burning feet you are also experiencing fatigue, weight gain, hair loss, and intolerance to cold, make sure to have your thyroid tests done. Look at all of the values: TSH, free T3, and free T4. Reason 6: circulatory disorder, the nerves are being deprived of oxygen. Nerves are extremely sensitive structures, and they need a constant blood supply to sustain themselves. When peripheral artery disease or general circulatory disorder is present, blood flow to the feet decreases. Nerves that cannot receive oxygen and nutrients begin to sustain damage. And this damage manifests as burning, tingling, and numbness. Additional symptoms of circulation-related nerve damage include pain and cramping in the legs while walking, color changes in the feet, bruising or pallor, slow-growing toenails, and a feeling of coldness in the feet. If these symptoms are present, you need to be evaluated for peripheral artery disease. Your circulation can be assessed with an ankle brachial index test. To strengthen circulation, regular walking is one of the most effective methods. If you smoke, quitting produces a dramatic improvement in circulation. Omega-3 fatty acids and beetroot juice are research-supported natural methods that support circulation. Reason 7: alcohol and toxin exposure. Alcohol is a directly toxic substance for the nerves. Long-term and regular alcohol consumption leads to a neuropathy that starts in the feet and progresses upward. This is called alcoholic neuropathy. But it is not only chronic alcohol use. Certain chemotherapy medications, heavy metal exposure, meaning lead, mercury, and arsenic and some industrial chemicals can also cause nerve damage. If symptoms began suddenly or appeared following a specific treatment, make sure to discuss this connection with your doctor. Can nerve damage be reversed? I hear this question every single day. And the answer is both yes and no. If nerve damage has progressed and become deep, full recovery may not be possible. But I can say this clearly, the progression of damage can be stopped in the vast majority of cases. And in damage caught at an early stage, significant improvement is possible. Nerves heal slowly. Rapid repair like that seen in muscle or skin does not occur. But with the right steps, nerves can repair themselves over time. Patience is critical throughout this process. Changes emerge over weeks, sometimes months. Steps you can take starting today. Now let us talk practically. Tests you need to have done first. Complete blood count. HbA1c and fasting blood sugar. Vitamin B12. Vitamin D25OH. Thyroid hormones TSH, free T3, and free T4. Kidney and liver function tests. CRP inflammation marker. All of these tests can be done with a routine blood panel. Make sure to specifically request them from your doctor. Nutritional changes. To keep blood sugar stable, never consume carbohydrates alone. Add protein or healthy fat to every meal. Reduce refined sugar and processed foods. Give up fruit juice, consume fruit whole and after meals. Foods that support nerve health: fatty fish, walnuts, flaxseed rich in omega-3. Leafy greens rich in B vitamin complex. Turmeric reduces inflammation. Eggs rich in B12 and choline. Daily habits. Take a 10 to 15 minute walk after every meal. This is one of the most effective methods for stabilizing blood sugar. Quit smoking. Its effect on circulation is dramatic. Limit or completely eliminate alcohol consumption. Check your feet every day, especially if you have diabetes or a circulatory problem. You may be unaware of small wounds. Regarding supplements. B12 supplementation on doctor's recommendation. The injection form provides significantly more effective absorption than the oral form. Vitamin D aim to keep levels between 40 to 60 nanograms per milliliter. Alpha-lipoic acid, an antioxidant supported by research showing positive effects on nerve damage. Magnesium, critical for nerve conduction. But I want to emphasize this in particular: always get tested and speak with your doctor before taking any supplements. My patient Linda's story. 67-year-old Linda, who came to my clinic, told me she had been experiencing nightly burning in her feet for 2 years and could not sleep. She had been to many doctors and her tests had come back normal. She had been told it was aging. We did a detailed evaluation together. Her HbA1c value was 5.9, meaning she was at the prediabetes threshold. Her B12 level was extremely low. She had been taking a stomach protector for a long time. We took 3 steps. We changed her diet and focused on keeping blood sugar stable. We started B12 injections. We arranged a gastroenterology consultation to switch her stomach protector to an alternative. Within 6 weeks, the burning had decreased noticeably. By the end of 3 months, she was able to sleep comfortably through the night. There was no miracle involved. We simply found the cause and took the right steps. The burning in your feet is not your destiny. This sensation is trying to tell you something. And listening to that message, asking the right questions, and having the right tests done is entirely within your hands. Do not say, "I am aging, this is normal." There is a reason for this burning. And in the vast majority of cases you can find that reason and resolve it. Which of the symptoms I mentioned in this video are you experiencing? Write it in the comments. I read every single comment. Share this knowledge with someone who is struggling with burning feet. Because knowing the reason can change everything. Do not forget to like and subscribe. I will continue sharing scientifically supported health strategies for individuals over 60 every single week. I am Dr. Natalie Harmon. Stay strong, stay aware, and take good care of your nerves. See you in the next video.